Hello and welcome. I'm Dr. Rebecca Novo with Dermatology Plastic Surgery, double board certified plastic surgeon. I'm so glad you're here at our virtual Ellacor experience event to learn more about Ellacor and to see if it's a solution for you. Please stay with us the whole program. We'll have a live Q&A session at the end. And remember, prize winners will be contacted via email. Thank you for joining us. We have some very, very special offerings for attending this event. Attendees will be able to purchase 2 Ellacor treatments of their lower face and get a third complimentary. That is over a $3,000 value. Also, if you're not sure about multiple treatments yet, you can enjoy your first lower face treatment and get a complimentary neck treatment, as well as an upgrade to exosomes after your treatment. That is a $750 value. So enjoy. I hope you learn. Thank you for joining us. Ellacor is a very special technology. Before Ellacor, there was no device or tool that we had to bridge the broad gap between laser and injectables and surgery. It was either laser, peels, and filler, or a lower face and neck lift. Ellacor was specifically developed to bridge that gap so that we could scarlessly remove skin of the lower face and neck, so essentially accomplish that lifting that most of us want without scars. I thought that it was a great fit for our practice to bridge that gap between injectables and surgery, and also great for patients that have had a past surgery, perhaps don't want another surgery, but would like improvement in skin laxity of the lower face and neck. Ellacor is a unique technology. It uses micro-coring technology, meaning if you imagine numerous, up to 64 tiny cookie cutters that punch and extract the skin scarlessly. So you're shrink wrapping the treatment area, which classically is the lower face, from the cheekbone to the jawline, from ear to ear. It's the entire surface area. You can physically remove up to 8% of that treatment area of the skin. And you're also accomplishing the benefit of that stimulation to improve collagen growth, regrowth, and rebuilding. So not only do you get a physical removal, but you also get the stimulation of new proteins and collagen being laid for optimal anti-aging. The main condition that Ellacor treats is skin laxity, the lower face and neck. We have done treatments in the body, and that is currently off-label, but we are having good success as well. Most patients have a concern of heaviness of the nasolabial folds, marionette lines, or an early jowl, which is skin laxity of the lower face or skin laxity of the neck. We've had this device for almost a year and have treated over 100 patients, and 99% of the patients appreciate a visible improvement in decrease in skin laxity and improved skin tone of the treatment area. Patients that are good candidates for this treatment in our practice either have mild laxity or have greater laxity, moderate to severe laxity, but don't want surgery. Most patients with moderate to severe skin laxity would qualify for a traditional lower face and neck lift. Often patients are fearful of a lengthy procedure or a lengthy surgical recovery. Because the healing is so rapid, meaning skin is concealable within 3 days. It's very attractive to patients who want to minimize their downtime, but yet improve their skin quality and aesthetic. In our experience with Ellacor, the most appealing factor is the rapid recovery. Patients are consistently concealable within 3 days, meaning if you have the procedure on Friday, you could wear a tinted sunscreen and some mineral foundation on Monday and return to work or social activities. That being said, we do a 1-week healing check. However, the full results are appreciated at 6 weeks. So there is a little bit of patience in seeing that final tightening with ongoing improvement even up to 3 months. Hi, we're here with our amazing patient who is our model today, and it's very brave to be on camera, so thank you. We're going to go over her consultation and talk about why she's an outstanding candidate for Ellacor. So if you hold that near, dear. Most patients choose Ellacor because they want a non-surgical lift, and where we see the most improvement in patients is when you start to get a small amount of jowl or heaviness in the nasolabial folds and marionettes. So where we see the most improvement, we've been doing this for about a year now, almost over 100 patients. In this triangle of the face, we get really nice toning and lift. Most patients do come in and say, I look better like this, but it's probably premature to do a major surgery. So now we have Ellacor, that is the skin removal. We're going to treat her whole lower face and really target this toning and lift. And then we're going to get smoothing of the jawline and contour. We're going to wrap her treatment under the jawline as well so that she gets a nice lift. So I would say our patient is the perfect candidate because of mild laxity. It would be very premature to do a facelift, but she wants some toning and lift of the lower face. Moderate to severe patients can have Ellacor as well as far as laxity. They tend to be more surgical patients, but if they don't want surgery, Ellacor is a great solution as well, even if you do have greater laxity. Thank you so much for joining us and taking your time to learn about Ellacor. It's my pleasure to be with you and share our passion about anti-aging solutions. Be sure to check your phone after this event and reply to any texts inviting you to schedule a consultation. You'll be contacted by our staff to schedule that consultation. It will be complimentary to you. Stay with us for the next 15 to 20 minutes while we go live with all your questions, and hopefully I'll have your answers. Thanks again.